Hello and welcome to this month's COVID and Wellness Update from Prisma Health Business Health Solutions. I'm Dr. Rachel Brown, Medical Director of Prevention and Wellness, and the good news is that the case numbers are going down. Maybe not as precipitously down as in some of the areas of the country, but still going down pretty quickly. I'm going to share my screen with you so that you can see the latest DHEC information. It is encouraging. So when we look at the tracking of the number of cases since March of 2020, you can see our several surges here. This was the Delta surge. And now here we are with the Omicron surge. Our last data point is from February 1st, just 3 days ago. Today is February 4th. And you can see we get this typical Omicron surge peak, and then it comes down pretty quickly. So hopefully in the next couple of weeks, we will see less and less cases. Now, to put it in perspective, that number of cases where we are, or at least in the last few days, is still higher than the peak number from our Delta surge. So there are still a lot of folks who are getting COVID. There are still a lot of folks who are in the hospital because of COVID. And all you have to do is look right over here at our county incidence, and you can see that every county in South Carolina is still at a high incidence of COVID with over 200 cases, excuse me, for every 100,000 people. So we'll continue to watch this number and hope to see some of these counties become lighter and lighter blue. Now, I do want to mention something very quickly around the subvariant you may have been hearing about, which is in the US. Not many cases, but we have found them, and there will likely be more cases. This is the Omicron BA2 subvariant. It has been found in other countries where it's been prevalent, such as in Denmark, that it is maybe slightly more contagious than Omicron. And remember, Omicron is incredibly contagious. Seems to not cause more severe disease than Omicron, which is good news, and also seems to be protected against by the vaccination, especially folks who are boosted. So all good news. It may make this surge look a little bit longer. Okay, we might see a little bit more Omicron BA, but we're hoping that we don't feel that impact like we did with the Delta surge, with many, many folks getting very, very, very sick. Now, I do also want to clarify that some of you may have heard that the Omicron BA2 variant is called the stealth Omicron. That is not because it is more virulent or causes more severe disease. It is not because it can't be picked up by testing. So please understand that our rapid antigen and our PCR test that we're using now will detect Omicron and will give you a positive COVID result. Okay. The other thing I want to mention about Omicron and its subvariant is that there's a lot of folks out there now saying, okay, well, coronavirus or COVID is just a cold now. It seems like just a cold. And for some people, that is the case. They have very mild disease, and thank goodness for that. But it is not the case for everyone. We are seeing significant numbers of very ill people in the hospital from COVID. So this is not the time for us to say, no big deal if COVID spreads. We need to protect our community. And we still haven't figured out exactly who is going to get the sickest from COVID. We know folks who are older, we know folks with many comorbidities will, and we know folks who are unvaccinated will. But we're seeing many folks who fall outside of those categories also becoming very, very ill. So I don't want anyone to become complacent and begin thinking that this is no worse than the common cold and we should just let it spread. We still need to mitigate this pandemic. All right, a couple of updates around vaccines. So let's go to the vaccine dashboard from DHEC. You will see that it has essentially not budged at all. So we've got 53% of eligible South Carolinians having gotten what's called fully vaccinated, which means the 2 doses of Pfizer or Moderna and 1 dose of J&J. This does not tell us how many of those folks are boosted, but the guesstimation is that about 40% of this 53% are boosted. So we don't have a lot of folks who are boosted out there either in South Carolina, and therefore we don't have the level of protection that we need against COVID as a state. We keep seeing research study after research study show how efficacious this vaccine is, especially when folks are boosted. And so just a few numbers for you to share if you're still trying to get your workforce on board with vaccination. Before we had the vaccine, out of every 5 to 10 cases of COVID, one of those people was hospitalized. Okay, so we're talking about somewhere between a 10 and 20% rate of hospitalization among all people who had COVID. Out of 30,000 people who had COVID, excuse me, 50 people, there was one death. So a very high rate of significant disease before our vaccine, right? The vaccine came along, the new numbers after a year of data are that if you're of everyone who has COVID, out of every 10,000 people, one is hospitalized after we've had a vaccination push. Okay, most of those people are unvaccinated. So compare that to 1 out of every 5 to 10 people who were hospitalized before the vaccination. We're now at 1 out of every 10,000 people gets hospitalized. Same thing with deaths. Before the vaccine, 1 out of every 50 people died who had COVID. Now, with a vaccinated population, 1 out of every 30,000 people dies. And most of those deaths are in folks who are unvaccinated. So there is no doubt this vaccine works. Being boosted really protects you. Continue to share this information, and please employ us and ask us to talk with your workforce about the vaccine. I'm happy to answer questions so that they can feel confident in the decision that they make for themselves. A couple of updates on our Pfizer and Moderna vaccines, EUA and FDA approval, and who can get the vaccine. So right now, you all know that anyone between the ages of 5 and older can get the vaccine. Okay, there's EUA approval for 5 to 15-year-olds, and there's full FDA approval for 16-year-olds and over to get the vaccine. Anyone 5 years and older can get a third shot if they're immunocompromised, and that occurs 28 days after the final shot of their primary series. For boosters, for Pfizer boosters, anyone age 12 and over can get boosted 5 months after their final shot. So either one of Johnson & Johnson or their second shot of Pfizer and Moderna. And for Moderna, anyone aged 18 and older can get their booster shot, again, 5 months after they receive that second shot of the Moderna vaccine. So that's a change, a little bit of a change. We don't have to wait 6 months. We can get that booster shot at 5 months. And if you get the Pfizer shot, that can go down to as low as the age of 12. On February 1st, Pfizer did submit its data to the FDA for review for vaccination of children 6 months to 5 years. So that last group that hasn't been vaccinated. Hopefully by the end of this month, we will hear something about whether those young kids can get vaccinated. And just a last fun fact for you, the Moderna vaccine did receive full approval, FDA approval, for its vaccine. So it is no longer simply emergency use authorized, it is also FDA approved. Now, you may have been hearing about some studies that are going on in Israel that are looking at a fourth dose. So series of 2 mRNA vaccines, a booster, and then a fourth dose. They're looking specifically at healthcare workers who, of course, are at high risk for exposure, and those over the age of 60 who are at high risk of consequences from getting COVID. So we're going to be watching that data closely to see if that informs us about all of those booster folks getting a fourth dose at some sort of interval. So stay tuned there. All right, let's talk about testing. I'm going to show you the DHEC testing site. Look at this. You can order free at-home tests if you'd like. Also, you know the government, this is through DHEC, is offering 4 free at-home tests. The average delivery time is about 10 days, so please take advantage of that if you need testing or you just want to have them around for when you might need testing. Here's an important button right here, how to find a testing location near you. Share this with your workforce. Testing is ramping up, the supply is getting better, but it can be very difficult to get tests, especially with the numbers we were seeing and continue to see with Omicron. So DHEC has taken over community testing for our state and is standing up very large, robust drive-through testing sites. Here's where you can find out where the nearest location is to you or to an employee. You can check with your PCP office to see if they do testing. Of course, retail pharmacies do testing as well. They tend to book up pretty quickly, and some private labs are doing that. Let's talk about home tests for just a second. They are becoming more and more popular and more sophisticated. They tend to have the same sensitivity and specificity, meaning accuracy, as the other tests that you get when you go to CVS or that you get when you go to a DHEC drive-through. They also tend to be, they're becoming more app-based, and so you have a platform that will actually record and time and date stamp that result, as well as send it to the public agency of that state. So in our state, SCDHEC. So that's pretty legitimate for those of you in HR and otherwise who are wanting to be sure that a home test is as accurate as you want it to be and reliable in terms of knowing when it was done and what the result was. Okay, I will tell you that Prisma Health is allowing home tests for our employees. If they're symptomatic and they do a home test and it's positive, we will take that. If they're symptomatic and their home test is negative, we do require a PCR because there is a high rate of false negatives in the setting of symptoms. Okay, so you can use that policy yourself and feel pretty secure that you're getting the right information from your employees. Also wanted to talk to you. Most of you should know and are probably excited that the Supreme Court overturned the mandate, the OSHA mandate, and the government mandate to require vaccination or weekly mandated testing for your employees. So that is no longer a requirement and probably is a sigh of relief for most of you. However, that does not mean that we here at Prisma Health and Business Health Solutions will not encourage you to continue to ask your employees to get vaccinated. That is the best line of defense against outbreaks, against illness, against complications, hospitalizations, tragedy, and against you having issues with your workforce and productivity. All right, what can you all do? I'm going to stop sharing my screen for just a moment. What can you all do as employers to help your workforce to remain safe and to follow these guidelines and remain productive as well? Well, the first thing is do not require a return to work test. For a very, very long time, and in fact, for pretty much most of this pandemic, the CDC, DHEC, Prisma Health, and other organizations have recommended that you not test an employee who is COVID positive and has fulfilled their isolation requirements before they come back to work. There are complications with the test, there can be persistent positives, and it's really just not going to serve you well. It's a use of the test that will burn through our testing supply that will keep people out of your workforce and keep your productivity low. So follow the clinical recommendations for quarantine and isolation. And so for someone who has COVID, they should isolate at home for 5 days. The day of their first day of symptoms is day 0, and then you count out an additional 5 days that they stay isolated. If they have not had a fever for 24 hours and they are feeling much, much better, significantly better, they can come back to work and wear a mask for an additional 5 days. So that gives you another 5 days to have your person back at work, assuming that they're feeling well and can wear a mask that you didn't have before with the old recommendations. There's no need for a test. Okay, so do not require a return to work test for your employee. I also would caution you against policies that require your employee to have a return to work doctor's note. If you can set up systems within your own institution to look at the date of when the symptom started, when the positive test was, and march out that 5 days after day 0 and talk with your employee to find out what their symptoms look like and if they've had any fever, you can feel comfortable bringing them back into your workforce, bringing them back on your site without having to ask your employee to jump through the hoops to find someone to write them a return to work letter. Many primary care offices are overwhelmed right now with folks who are sick. You've got urgent cares that are experiencing the same thing. So it's going to be really difficult for your employee to find that letter and to return to work, and that's going to keep them out of your workforce and keep them from being productive. The other thing that you can do is investigate whether you want to use home tests. Like I mentioned before, they are reliable in the setting of symptoms. And so if someone has a home test that's positive and you don't need them to go to somewhere that can print out a formal positive result for you, then that might be another route to go to make things a lot easier for you. Please encourage your employees to get vaccinated and boosted and reach out to us to hold vaccine clinics on your site and booster clinics on your site. We can do that very easily for you. So please reach out to us to schedule that. Do not forget masks and distancing. They have been the foundation of mitigating this pandemic from the very beginning, and nothing has changed. If we do get to a place where we have counties in our state that are of low incidence of disease burden, then you will see CDC and DHEC begin to recommend that people who are vaccinated, likely who are boosted, that's called up to date with their vaccinations, can stop masking in certain situations. But for now, the entire state is pegged at high incidence, and so everyone should be masking in your workplace. And as much as you can encourage them to mask outside of the workplace, that's going to be a huge barrier to spread in your workplace of COVID. And then finally, this is a tough one. We know that you all are stuck between a rock and a hard place, but trying to remove the barriers of folks being able to stay home when they're ill. Someone who is sick is not going to spread the disease if they don't come in to work. And let's face it, even if they're waiting to find out if they have flu or just a common cold, you don't want that spread at your workplace either, because all of those people will not only feel bad and maybe have to stay home because of their symptoms, but they'll all have to be evaluated for COVID, right? And we know that takes time. So please encourage your folks to stay home when they feel ill and do whatever you can to make sure that there are no barriers to them doing that. All right, I'm going to show you one last resource, which I, of course, show you every time, and that is our webpage, Creating a Safer Workplace. Of course, there are lots of answers to your frequently asked questions on this page. All my videos are here, but this number is where you can call. You can call us to set up consultations. You can call us to talk about what sorts of policies make the most sense to bringing people back to work. You can call us to set up a vaccine clinic or booster clinics. We want to do that for you. We want to help you and make sure that this pandemic does not impact your workflow, your employees' health, happiness, and safety, and your productivity. So please feel free to reach out to us. That's the update for this month. Remember, we're here to take care of you so you can take care of your workforce, and I'll see you next month.